Welcome to Humanotic, unlocking the secrets inside your body and brain. In this video, we'll cover the core principles, equipment, and scientific concepts behind laparoscopic surgery, ideal for medical students preparing for clinical exposure. Pneumoperitoneum, creating the working space. Laparoscopy begins with establishing a pneumoperitoneum, a controlled expansion of the abdominal cavity using carbon dioxide gas. Why carbon dioxide? Because it's non-flammable, rapidly absorbed, and easily cleared by the lungs. The insufflator maintains a stable intra-abdominal pressure, usually in the low teens mmHg range. This pressure gently elevates the abdominal wall, creating the necessary visual and working space for the instruments and camera. Students must understand that pressure regulation, gas flow, and patient physiology are continuously monitored during the surgery. Port placement strategy and AMP, triangulation. Ports are the small access points, typically 5 mm to 12 mm, used for the camera and instruments. The key principle is triangulation. The camera port and two instrument ports are arranged so they form a triangle targeting the operative field. This geometric setup provides stable visualization, ergonomic instrument movement, improved depth perception on the monitor. Students should also recognize the fulcrum effect. When instruments pivot at the port, internal motion is opposite to external hand movement. Mastering this concept is essential in laparoscopic coordination. The optical system and AMP, visualization. The optical system is the surgeon's eyes. A laparoscope, usually a 0 degrees or 30 degrees lens, transmits high-definition images to a monitor. A 30 degrees scope allows the surgeon to visualize around anatomical curves by simply rotating the camera. Key principles students should know: white balancing and focusing, preventing lens fogging, relying on visual cues because tactile feedback is limited. The precision of laparoscopic surgery depends heavily on clear visualization and controlled camera movement. Laparoscopic instruments, design and AMP, function. Laparoscopic instruments are long, slender tools designed for precision through narrow ports. Common tools include atraumatic graspers, Maryland dissectors, endoscopic scissors, clip applicators, energy devices, monopolar, bipolar, ultrasonic, important concepts for students, hand motion scaling. Small hand movements result in fine internal movements. Reduced haptic feedback. Force judgment is primarily visual. Energy application principles. Understanding thermal spread and avoiding collateral effects. These tools emphasize precision, leverage, and delicate tissue handling, not force. Tissue handling concepts. Laparoscopic tissue handling is based on foundational surgical principles, adapted for a video-assisted environment. Essential ideas include controlled traction and counter-traction, avoiding excessive tension on delicate structures, interpreting tissue behavior visually, applying energy with awareness of nearby structures. Recognizing anatomical planes and respecting tissue limits are key learning objectives for students preparing for surgical rotations. Safety, physiology, and ergonomics. Laparoscopic surgery introduces unique safety considerations. Students should understand how carbon dioxide absorption affects ventilation, cardiovascular effects of increased intra-abdominal pressure, the importance of surgeon ergonomics, monitor height, hand position, and posture, the role of coordinated communication within the surgical team. Potential risks, though uncommon, include issues related to pressure, energy-related injuries, and port site complications. Awareness and prevention are central to safe, minimally invasive surgery. Laparoscopic surgery blends optics, engineering, anatomy, physiology, and surgical precision. Understanding these core concepts prepares medical students for future hands-on training. If you want more surgical education videos, subscribe to Humanotic and feel free to ask in the comments.